My fellow Idahoans, the arrival of a safe COVID-19 vaccine in Idaho just a few weeks ago means we're in the final stretch of our pandemic fight. This is a truly uplifting sense that we have turned a corner, and I want to thank all of you for your perseverance over the last 11 months. I want to provide the people of Idaho an update today on our work to distribute vaccine throughout Idaho as quickly and safely as possible. Our goal with vaccine planning and distribution is, in part, to reduce transmission and preserve a functioning healthcare system, and to get back to normal as quickly as possible. First, I want to assure you that Idaho accepts all doses as soon as they are allocated by the federal government. All of those doses are then shipped directly from the manufacturer to local public health districts and healthcare providers. I want to be clear that no doses are shipped or stored at the Idaho Department of Health and Welfare or any other state entity. All doses allocated to the state of Idaho are shipped directly from the manufacturer to the local public health districts and enrolled providers as soon as they are available. Our partners at the local public health districts, providers, and pharmacies are coordinating plans for their local areas. Since mid-December, more than 33,000 long-term care facility staff and residents and healthcare workers providing care for COVID-19 patients have received vaccines. The bottom line is, vaccines are being administered safely and successfully in Idaho. We plan to accelerate the pace while ensuring a sustainable cadence of vaccination moving forward. When it comes to the vaccine rollout, I want to distinguish between the role of government versus the role of providers. As one of our healthcare advisors put it, the challenge is not getting vaccine to the hospital loading dock. Getting vaccine administered to people is much more complicated. The state of Idaho gets the doses and resources to the providers, and the providers get the shots in the arms of people who want it. Second, to our providers administering the vaccine, I want to assure you that there are ample resources available to you to get vaccinations administered as quickly as possible. The state of Idaho has received millions of dollars to ensure the efficient rollout of vaccine in our state. And simply put, there are no resource barriers. As of this morning, we have 247 enrolled providers that can administer vaccine across Idaho. We will be communicating with these hundreds of hospitals, pharmacies, and local public health districts and other providers in the coming day about our new plan to ensure you have a full financial support to administer the shots as quickly as possible so that we can build capacity and get Idahoans vaccinated. Third, to shine light on the vaccine distribution, we made a new dashboard available at coronavirus.idaho.gov. The dashboard shows by county the total number of people vaccinated and the total number of doses administered in that county. Additionally, we are actively building the dashboard to show how many doses have been shipped to each county as well, so providers and the public can compare doses shipped versus doses administered in their county. This is another step in Idaho's commitment to transparency through the pandemic. Lastly, I want to share with you my decision to adopt the recommendation of the COVID-19 Vaccine Advisory Committee last Friday. Idahoans aged 65 and over, along with teachers, school staff, first responders, and other frontline workers, will be included in the next phase of vaccine rollout. This will include an estimated 500,000 Idahoans. However, we will prioritize teachers, school staff, first responders, and some frontline workers between January 13th and January 31st, before making doses available to the 65 and up population starting February 1st. Why? Because the 65 and older population is enormous, and there's still work actively being done to build up capacity among our providers to take on this population. We do not want to create a bubble or backlog. Once we get a handle on capacity, we will be able to get to the 65 and older population. Also, the health of our teachers is paramount to ensuring students can learn in the classroom where they deserve to be. To summarize, between now and the end of January, teachers, school staff, first responders, and some frontline workers will be able to access vaccinations. Idahoans aged 65 and older will be able to access vaccinations between February 1st and February 15th, along with the rest of frontline workers. I want to thank the members of our COVID-19 Vaccine Advisory Committee, made up of Idahoans, for helping me make decisions about who should be prioritized for the limited vaccine. I encourage Idahoans to continue to access up-to-date vaccine information at coronavirus.idaho.gov. In addition, immediately following my announcement, Health and Welfare will host their weekly media briefing that you can watch online. The weekly briefings will continue to be held on Tuesdays at 2:30 p.m. Mountain Time. Thank you, and God bless.